So today I'm going to be doing my pre-lab video for inserting a GI tube as well as taking it out. So to start, before I go into the room, I'm going to check the patient's records, make sure the order is correct, and then I'm going to perform hand hygiene. Once I do that, I'll enter the room, I'll identify the patient, explain to the patient what I'm going to be doing, and I'm going to close the curtains for privacy. I will raise the bed up, and I will also bring it to a 45-degree angle tilt so it makes it easier to access the nasal passages. So first what I'm going to do is I'm going to take the drape and I'll drape it over the chest of the patient. I don't have the drape right now, but that's what I would do. And I would also take the Emerson basket and put it underneath by the patient's chest in case they do get sick during the procedure. After that, I'm going to measure the distance of the tube. I'm going to measure the distance from the tube, from the nose to the ear, to the earlobe, and then from the earlobe to the xiphoid process. And once I do that, I'm going to take the mark that it got to so that I'll know how far to go with the NG tube once I insert it. And once I have that, I can put on my gloves and get ready to go. Okay, so once I have my gloves on, I can start getting ready to insert the GI tube. I will take lubricant and I'll put it on about 2 inches of the GI tube. Then dispose of that once that's done. Now I get that stuff situated. After that, I'm going to have the patient check which side of the nose they can breathe easier out of by putting one finger on one side and breathing in. This patient, it's the right side, the right nostril. So I'm going to tell the patient to breathe in. As they're breathing in and tilting their head back, I'm going to insert it into the nose. And once it goes in, once it hits the pharynx, that's when the patient will probably start to gag and their eyes may water. But you'll just have to keep pushing it through until it gets all the way to the stomach. If the patient says that it's very discomforting, you will stop immediately, and then if for some reason the patient's not stopping gagging, you can check in their mouth with a pen light to make sure that the tube isn't all tangled up in their throat and not going into the lungs. So once we get that, and normally on a real person it would not be this forceful because it wouldn't be on a mannequin that's like this. Okay, so the GI tube is where it needs to be. After that, I'm going to, I would have had the patient, as I was actually inserting, put their chin to their chest and drink water so that it made it easier for it to go down. I forgot about that, but that's what I would do. After that, I'm going to confirm the placement that it is in the stomach. There's 4 different ways. I can check the pH of the stomach contents, do an x-ray, I can measure the length of the tube, or I could aspirate, which I'm going to show now. So I will unplug that, uncap it. I will put the syringe in, and then I will pull back to check the contents of the stomach that hopefully come up into here. When I check the contents of the stomach, I'll check color, any discoloration, consistency, etc. Once I do that, I will then I will pinch the tube, and then I could pull off the syringe and cap it. Cap the tube back up. Once I cap it, then I could tape it to the patient, onto their gown, of course. And then I will also tape the tube onto their nose as well. So I'm going to use one piece of tape, but I'm going to make 2 strips out of it, so that once I tape it onto their nose, I can take one piece and go underneath the tube, as well as take the other piece and go over the top of the tube, which obviously doesn't look the best. Okay. Once that is done, I can remove the drape, and I can take off my gloves and perform hand hygiene, and take this away and bring the patient back to whatever level they need to be on, as well as lower the bed. Once it's time to remove the tube, I will do the same thing I did before. I will come into the room. I will introduce myself to the patient. I will perform hand hygiene, of course, let them know that I'm removing the tube. And then I'm going to put on gloves to get ready to do so. I will tilt the patient's bed back up to a 45-degree angle. Put on my gloves. If the tube is connected to the section, I will discontinue that and separate it from the sectioning, and remove the tape. So I can tape here. So tape. After I do that, I'm going to take about 10 milliliters of air, and I'm going to take the bottom and insert the syringe into the bottom of the tube. Now before I press that in, I'm going to take off the tape so that I'll be ready to take that off. Okay, so the tape is removed. Once I do that, I'm going to press the air in, and then I could pull back up slightly to check to make sure that it was still in the stomach. I can then remove the syringe. I will clamp the tube, remove the syringe, and then I will have the patient take a deep breath, and when they take a deep breath, I'm going to remove the tube, and I can dispose of the tube once I do that. I can remove the gloves, perform hand hygiene, and then I will also put the patient back to whatever elevation they need to, lower the beds. I'll ask them if they need any mouth care. I can help them with that, and I can also give them any tissues that they might need from the removal of the tube. After that, remove any PPE that I had to put on, and measure any drainage from the drainage area that I would need to, as indicated, and perform hand hygiene once I leave the room.